Very good evening, all. I'm Aditi Lamba, coming to you from a remote location in New York City. This is the Tuesday night Vision of Asia. Welcome to our ongoing report on coronavirus pandemic and the South Asian voice. Current world count of coronavirus cases has surpassed 3 million, with more than 200,000 deaths globally. About 30% of the cases have occurred in New York, the epicenter, followed by New Jersey, Massachusetts, California, and Pennsylvania. While this is happening, U.S. states Georgia, Texas, Michigan, Hawaii, and Alaska have started reopening in process. In the tri-states, the governors are reminding all to stay inside, stop the spread of the virus, and save lives, and allow the healthcare workers to take care of the critically ill. Today in New York City, the U.S. Navy Blue Angels and the U.S. Air Force Thunderbirds demonstration teams participated in a midday flyover of the city as a part of America Strong, honoring first responders and essential workers during the outbreak of COVID-19. Reach us with your experience on events at itvgold.com. If you are a South Asian doctor or healthcare worker on the front line, we're thankful to all the professionals that are bringing updates, information, and all details on the coronavirus pandemic. And tonight's show comprises of more, featuring medical professionals, elected officials, and much more from New York City. Here are the headlines. Dr. Ibbad Yousuf on COVID-19, Frontline Experience, Updates and Measures, ITV Gold. Council member Donovan addresses South Asian Americans, New York City Council District 31st, ITV Gold. NRIA on investment opportunities and resources during coronavirus pandemic, ITV Gold. A lot more on the other side of the break. Stay with us in Vision of Asia COVID-19 special report. We'll be right back. Welcome back. I'm Aditi Lamba. This is Vision of Asia special report on coronavirus impact, measures, and updates. Today, New York Governor Andrew Cuomo outlined a 12-step plan to reopen parts of the state while trying to keep the coronavirus pandemic from flaring up again. He also said that hospitalizations, intubations, and deaths are on a decline. However, there still requires a continuation of social distancing as well as monitoring of the outbreak and tracking the spread. Lots on measures regarding reopening of New York and the role of state and local government. We spoke to New York City Council member Donovan recently, highlighting latest developments and updates. Council members shared many steps and measures being taken by his office to curb the issue of hunger, as well as financial security for New Yorkers that are struggling economically during this pandemic. Also, discussing racial disparities seen during COVID-19, Councilmember Richards also called for support and focus on minority immigrant voices and communities, addressing South Asian healthcare workers and other frontliners. Here is the story.
So in terms of addressing, the brown communities and the Black communities, we are talking about racial disparity right now. Yep. There is, so much we're hearing in the news about the needs of their communities, what is happening around, in the hospitals there. Could you please address, the South Asian American community, the Inter-American community, all brown and Black communities here on ITV Gold, but also address us on what should we do about what's happening here right now?
So the first thing is to make sure that the city and the state are concentrating resources in our pockets. And I was very happy because I actually wrote a very scathing editorial a few weeks ago about the lack of testing and data. Data is very important when you're talking about getting resources into pockets of the South Asian community, into Black and brown communities, period. So that data was central in us being able to tell our stories. So once that data came out, it showed how impacted South Asian communities were, African American communities were, our Hispanic communities were being impacted. So that was the impetus in now us starting to get some movement on testing sites in our communities. What should be happening right now is that the city should be concentrating services into the pockets of our communities. Now, everybody doesn't have internet access, so you may have to do snail mail. You have to work with local community-based organizations because not everybody trusts government. We're scared. My dad just became a citizen last year. We all are scared of the Trump administration, what they will do during this time. Will they use the information they get to deport us, right? So the city is now, the mayor has sort of said he's going to start pivoting towards ensuring direct text gets to people, that CBOs, community-based organizations who we trust, could get the resources to get information out, the testing being enhanced in our communities, food access, which is huge.
Yeah.
Food access, more resources being poured into the pockets that have been hit the hardest is going to be central in getting our communities moving forward. I do feel relatively good about now more PPE reaching our hospitals, but we need to make sure PPE is also getting out into our communities too. So that's going to be the next venture we're pushing for as well.
And in terms of addressing another huge group of people who are truly at the center of this crisis, are children. After we look at communities of color and all of the other things happening in the hospitals, children are all home. To millions and millions of Americans that are sitting here right now, it has put the entire American life into a strange environment. I would like for you to give us an insight into what's happening with the public schooling system, especially in New York City, and what resources could we look forward to, because we have a lot of parents watching you right now.
So first off, you should go to, if you're watching and you have internet access, schools.nyc.gov. And you should look on there. There's a bevy of resources, whether it's around food, whether it's around internet and access to laptop carts if your children actually go to a public school. And one of the things I've been pushing on is ensuring that every child in our New York City school system has access to a laptop and to the internet. I mean, there's no reason that our kids should fall behind during this crisis because the Department of Education isn't getting the information out. So I think as of last night, they shipped out about 215,000 devices. Wow. But we know that there are 1 million school students in our public school system. So language access is critical. You have to have materials that speak the language Bengali and, whatever language you speak the language of the community. So we're pushing hard to make sure that those resources and people know that they can get those devices and access to internet immediately. The food stuff seems to be moving good. I know even for Ramadan, yesterday there was a great announcement on more food being poured into communities so that no one goes hungry even during this time, because we're all together, we're all trying to be together. It's a little different this year, but ensuring that those resources are being poured in. And then also the services are going to be very important. One of the things I'm most worried about is for our kids with disabilities, and how is the Department of Education ensuring that those children who need access to resources won't be left behind. I want to be honest, it's possible, and I think I've been reading between the lines a little bit, that you can see us going into fall and a lot of our kids still being home partially because of the COVID pandemic. I know, I was like losing the word. So mental health is what I'm most worried about. Yes. I have a 4-year-old, by the way. I do remote learning with him. Wow. Very tough. So it's very important for the parents watching. And I just did a virtual town hall on mental health this week. Right. Very important for parents to ask their kids about their feelings. So I asked my son, are you sad? When he started acting out a little bit. And, he said he's sad. He misses his classmates. Yeah. So we have to actually communicate. I would also add, sorry, I'm taking long on this. Of course. We need to make sure that there's a regular routine for them. Yeah. So very important. And that's something the specialist talked about. So putting your children on a schedule is very important. I'm lucky because my wife's an educator, so I'm able to follow her lead on this stuff. But make sure you're putting your children on a regular schedule.
NRIA, National Realty Investment Advisors, is an award-winning investor, developer, and owner of luxury apartment communities across the states. For more than a decade, NRIA has been serving the community with a depth of knowledge in compelling opportunities across real estate investments risk spectrum. On that, recently we spoke with Senior Vice President of NRIA, Mr. Arthur Squitero, bringing in perspective of safe investments and opportunities during COVID-19 and its impact on economy. Reflecting on various resources, changes in 401k plans, and much more, Mr. Squitero provided details on how to look at investment opportunities during this economic crisis and the ongoing programs with NRIA. Here is the story.
Right now, as we're talking about, this change for the 401k plans is ideally for someone that needs to borrow money, but also it opens up
Correct.
opportunities for people to invest in order to, maybe make back that money that they have lost during this time period. So what I'm
Sure.
saying
Yes. Yep.
here is that there is somewhat of a connection between somebody right now making a smart investment decision and investing into the right assets so that they can make some money back. Because look at the economy; it's not the greatest right now.
Sure.
So, talk to me a little bit about, understanding that a little bit more with you, Mrs. Kitara. I would love that to understand: is it safe to invest right now? And if so, what other things can we invest with NRIA? And this 401k plan, how good could it be for somebody who's looking to invest and just get a little bit more money, because times are tough right now.
Sure. Sure. Well, I think, you know what? If we take a wait and see approach, we're going to lose an opportunity. Right now, especially with the use of a 401k, you get the double dip. I mean, I don't know any place else where you can use the same money and make double returns, right? Return from your stock portfolio and return from a real estate investment with us. So that's a fantastic, unprecedented opportunity. But, you don't have to use 401k money or IRA money. You can directly invest using cash, of course. Some investors who are a little savvy and maybe pulled out of the market early and they're sitting on this cash. They don't know what to do with it. They're like a deer in the headlight. They're afraid.
Right.
Well, let me share with you what our investment does, which is also unique. Not only do we offer higher returns than the average, but we also offer a safety net or a minimum corporate-backed guarantee. Everybody who offers an investment opportunity can offer their investors a guarantee.
Right.
I don't know of anybody else who does this. We have since 2007, and we made it through the skies falling to 2010 during that whole real estate implosion and financial crisis with 0 project failures, 0 foreclosures and lawsuits. Thank God all of our clients have made money with us. But currently, if you invest, if you sit on your money, what are you making in the bank? There's like no interest return there, right? It's so minuscule. Matter of fact, if you compare it to just the cost of living, you're going to lose money if you leave money in your bank or you leave it under your mattress. You're losing money. So what do? You find an opportunity. Obviously, we have one, but you find an opportunity where your risks are mitigated. In our model, you're coming in through an LLC, so you're not taking on any of the liability. You're getting the best of both worlds, no liability and indirect ownership. You also look for a company that has a great history. Thank God we have 14 years of impeccable history that we can share with our investors. Third, you look for a company that's got cash or cash rich. We're in a fantastic position where we are cash rich as a company. But most importantly, a company that's going to stand behind their product. We give our clients a guarantee at 12% minimum return. So if you invest with us, we're basically saying, listen, outside of the fund has $724 million in it. It's a perpetual evergreen fund. So we're always buying, building, selling. There'll be more property, 4 to 6 properties added every year, and we sell off property. However, behind that, National Realty offers our clients using our own corporate assets $350 million, a guarantee of 12% and the return of the principal. We're basically saying whenever you leave the fund, if you're leaving and there's not enough to cover a minimum of 12%, National Realty would come to the table with that shortfall. And in our model, we're starting out with a 30% equity over cost position. So our model maintains this 30% equity, this margin. And that's very important to understand because if there is a correction, values of property drop, we have a 30% cushion before our company principles affect.
Right.
And we have a 5 to 7% equity investment in our properties. We always have skin in the game, 1 to 5 million per property. So standing in front of the investor is a 35 to 37% equity position. Almost $300 million sitting in front of them as added protection. That would have to be depleted or exhausted before it negatively affected the investor. And keep in mind, in our market, because the majority of our property is rental, in our exit strategy, we can take a condo and turn it to a rental, let it cash flow. And when the market strengthens, we can put it back up for sale and sell it out. So our exit strategy, we have more than one approach. We can rent out everything. We can sell everything. We control the out use of the property. Therefore, we're keeping investors safe. If the market's not ripe to sell something, we rent it. If it's not time to sell it, then we'll continue to rent it and let it throw cash flow. I mean, some of the apartment buildings that we're building throw off $120,000 a month net, $75,000 a month net, $90,000 a month net. All that net cash flow comes back to the fund and pays our investors their returns. So it's quite a unique model.
They're showing the safety net that we're talking about. It makes sense.
Yeah, it really does, but I would suggest, listen, if you take a wait and see attitude, you're losing an opportunity. In a down market, you always have opportunities. We have opportunities. We will probably have opportunities to buy property maybe cheaper than what we have before. We're going to have, different opportunities from lenders now that money can be borrowed at such a cheap rate, right? These are the lowest interest rates in 70 years. Same ways, if you look at every down market, usually that's when new companies are birthed, right? Unfortunately, the door may close on some companies, but then new companies are birthed, new ideas. So with the yin comes the yang, unfortunately, right? As they say. But thank God we're resilient people, and I believe that we'll continue, after this pandemic, as a country and as a world, we'll bounce back.
It's time for the short break on Vision of Asia, Voice of the Community. Stay with us. We'll be back shortly. Welcome back. This is Vision of Asia, Coronavirus Pandemic Special Report, and I am Aditi Lamba. Let's now take a look at our recent conversation featuring Dr. Ibbad Yousuf, briefing us on the latest developments and advice coming in on COVID-19 and its impact on the nation. Here in New York City, according to Governor Andrew Cuomo, at least 335 people across the state died of coronavirus yesterday. In the country, there are more than 1 million cases and more than 57,000 deaths. Dr. Yousuf provided perspective on these numbers while also giving us an insight into the emergency room, drug trials, and testings. A take on reopening, he highlighted strict social distancing for areas such as here in New York City and to focus on mental and physical wellness during COVID-19 crisis. Here is Dr. Ibbad Yousuf on his Frontline Experience.
PPEs, they have been discussed nationally. Even now we're talking about many hospitals in New York still not having enough PPEs. Doctors asking for people to donate PPEs if possible. Your take on how important these were in the initial days of COVID, and how has the process been now that certain hospitals have been getting them?
So PPE is very important. I know the media, it was a huge issue with people realizing that hospitals in general weren't necessarily prepared for a pandemic, and it's beyond the hospital systems, which people don't necessarily understand. It's not necessarily to the fault of a particular hospital. A lot of our manufacturing systems and global supply chain was disrupted. Wow. Personally, I know myself and a bunch of my colleagues, we all either purchased or the department or the hospital helped us get respirator masks, which are reusable. You could wash the outside, you could remove the filters and add new filters on. I know that that's helped a lot in reducing the one-time use, or what was supposed to be the one-time use, N95 masks. It still is just as important. We still treat every patient as if they were to have an infectious disease, whether it's coronavirus or something else. I think that's also an important point I had mentioned to some friends the other day, was in the ER, you're getting an undifferentiated patient. So part of your duty on any given day could be taking care of somebody who has something communicable, whether through aerosols or cough or droplet or through blood. And this kind of points out the importance of PPE in that overall sense. I think there was a kind of a relaxed attitude overall in ERs.
Right.
I know a lot of my mentors and and supervisors and attending physicians always mentioned, Always go in as if you can catch something. I think some of the latest data, there was a report the other day that was showing that SARS-CoV-2, the coronavirus, can stay on N95 masks for up to a week.
Oh, wow.
So that kind of raises a question with our use of these masks in certain places and stuff like that. So,
could you describe to our viewers how much PPE you have to wear, and just from like top to bottom, how much you have to cover yourself in order to treat one patient in the ER?
It's uncomfortable. That's the best way I can at least describe it. I have my respirator mask, which has 2 filters built on. It creates a suction seal. It has 4 straps that tie up on the top and at the bottom. And then there's a valve so that you can get some breath in. You still get very dizzy in it. You're still breathing in a lot of your own, carbon dioxide. They're uncomfortable. They're tight on your face. That's probably the most important thing. We have seen that there are cases that have ocular transmission.
Right.
So I know when we're doing invasive procedures, the intubations, placing central lines, in the internal jugular vein, I always wear my glasses. We have goggles, glasses, and/or a shield on top of that.
Wow.
Had a lot of people reach out and help support. A lot of 3D printing companies have helped build us shields.
Right.
As the global supply chain was disrupted. And then just the gowns. I think gowns are typically short in most places. It's not something that we, anticipated as much. I think these are the typical sterile gowns that, surgeons would wear in the OR or when we're doing invasive procedures in the ER. Those tend to be better used. I know a bunch of us have personally sourced essentially the full body suits.
Wow.
Made from Tyvek kind of material or certain plastic type of materials that are washable and reusable. So that's what I've been using now. It's the full suit.
Wow.
On top of the mask, with the goggles, I have a surgical hair cover, and then the face shield, just to minimize the surface area that's touching my body and possible exposure to the risk of the virus.
Wow, that is incredible. That is a lot of material that you have to wear in order to treat one patient. Just talking about patients, I would like to highlight some of the high-risk patients whose questions you've been getting. In the South Asian American population, Dr. Yousuf, we see a lot of heart patients, stroke patients, you have diabetes, blood pressure, high cholesterol, you name it. And we have certain of these, high at-risk patients. Your comments on what you've seen with those patients, especially with COVID-related issues in the ER, and also maybe a word of advice to them into how they should take care of themselves or when they should go see a doctor if they are worried.
Thank you very much for bringing up this point. I think it's especially important in the South Asian, the Desi community. My father himself has the same high blood pressure, high cholesterol, diabetes. He's actually had heart surgery, open heart.
Wow.
And I'm very scared for him. I haven't seen him or my mother in, a few months now. I've been telling them to maintain the strictest precautions just because they are at a higher risk. Not going out if they don't need to. My younger brother is at home with them. He's helping get groceries when are needed. And they're kind of just staying in the home where we're lucky to have a backyard. They've been walking around, getting fresh air. But it's real. The data we're finding is that people with these comorbid issues are at higher risk. We're still trying to work out the science as to why. There's a few theories out there on the microbiology and the cellular biology of receptors and what these diseases do to the body as far as the pathophysiology.
Right.
The whole going to see your physician, a lot of primary care physicians, even ERs are now doing telehealth. So I think to use it at the beginning,
Right.
if something feels off, people know their bodies very well. So if something feels off and you're kind of scared to go to the ER, call into your physician, call into your doctor, call into your provider, have them, give you a quick assessment. And then if they think you need a higher level of care, then you should definitely go to the hospital. Definitely go to the ER. Don't be scared to go to the ER, in fear of catching this or, in fear of lightening our load per se.
And this is all for tonight's show. Remember to send us your suggestions and get your voices and organizations on our show. Email us on events@itvgold.com or follow us on Facebook @itvgold. You can also now subscribe to our YouTube channel to watch many of our popular shows for free. Thank you for joining us tonight from Queens, New York. This is Vision of Asia. I am Aditi Lamba. Take care and be well, and please stay safe.